Hi, my name is Karen Noblet, and I'm a urogynecologist at the University of California, Irvine. Today I want to talk about an important condition called urgency incontinence. Urgency incontinence and the term overactive bladder really affect 1 in 3 adults over the age of 40 to a pretty moderate or significant degree. And the symptoms can have a real impact on quality of life. And they can impact really all domains of quality of life and limit a woman's or a man's activity to really feel comfortable in participating in things. Now, fortunately, we have lots of treatment options that we can offer our patients. And a recent study that we did, we looked at why people don't come in to get treatment, and we found that fear of treatment was one of the barriers. So hopefully, by educating and getting this information out, it will allay some of the fears that our patients might have in seeking treatment options. So we can start with very simple conservative options, including dietary management, fluid management, education, doing some exercises, having them see our pelvic floor physical therapist. If those measures don't work or meet the patient's satisfaction, we can move them quickly into trying some medications. And we have options in those medications. We have multiple drugs that we could try. And if those then don't again provide the benefit, we're able to benefit some of our patients with the conservative, some with medication, but there's some that actually are refractory to those, and we actually now have some third-line therapies that they can go on to. Some of those third-line therapies, one of them that I want to really specifically speak about is called sacral neuromodulation or InterStim therapy. InterStim therapy is a very unique therapy in that it helps restore the communication between the brain and the bladder, which we think is one of the problems that leads to this urgency incontinence. So if we can restore the proper communication between the brain and the bladder with this therapy, the patients can maintain and regain control and have significant improvement in their quality of life. The therapy is also very unique in that there's a trial period. The patients can actually try this out. They can go through a test period and decide, did this therapy work well for me? Is this something that I want to continue on with? Very similar to trying the medications. They can try it for a period of time and decide, do they want to go on with this? So that's one of the great aspects of this therapy as well. So fortunately, we have, again, a stepwise therapy that we can go through with our patients. We have so many more options to be able to offer them than we did in the past. And hopefully, as we educate more and get the information out there, our patients will come forward and seek evaluation with a urogynecologist or a specialist in female pelvic medicine and reconstructive surgery.